So it sounds like you're really targeting American cultural practices as opposed to like worldwide. So what are the specific American cultural practices that disrupt this mother-infant bond?
Here are 6 primary practices. First, a clarification. For example, if common cultural practice A is associated with behavior B, and the percent increase in behavior B is from 5% to 20%, this is significant, though most people do not have behavior B. Therefore, when I mention a cultural practice, and you or your child does not have behavior B, this does not refute the result that behavior B is more likely to occur. If you are a parent, upon hearing some of this information, you may be tempted to blame yourself for what you did or did not do in raising your children. Please don't. In this society, as in others, parents do the best they can based on what they know, what the culture supports, their personal circumstances, and other factors. Similarly, professionals who work in related fields are subject to personal, professional, and cultural constraints on their activities. Let's have compassion for ourselves and others. Many people have experienced at least one of these practices. So first, there's hospital birth. A typical American birth is transformed from a natural event to a medical event. The mother gives up control of the birth to a doctor. Routine experiences for the baby can include the pain, distress, and possible physical injury from amplified contractions connected with induced labor, the use of forceps extraction following the use of epidural anesthesia, premature clamping and cutting of the umbilical cord, an injection of vitamin K, burning and blurring eye medication, heel lancing for blood samples, injection of hepatitis vaccine, and being straightened out for measurements. The effects of all these routine experiences on the infant are ignored. The separation of newborn babies from their mothers after birth, still standard policy in many American hospitals, can result in psychological trauma and long-term neurobiological changes. Newborn infants have an urgent need to be held by their mothers. The separation is more prolonged for those infants in neonatal intensive care units. Being placed in these units involves considerable invasive pain for infants. Designers of these units did not consider that infants could feel and remember pain. If they survive, many infants are left with long-term emotional distress. No study shows that birth in a hospital is safer than birth outside of a hospital with competent support. With #1 being the lowest rate, the United States ranks 56th in infant mortality and 47th in maternal mortality, among other countries. More technology and drugs do not necessarily make birth safer. They make it more likely that there will be unnecessary interventions with the natural birth process, resulting in complications. A number of studies suggest a relationship between birth complications and violent behavior. In a study that received national attention, investigators followed over 4,000 male infants to age 18. They found that those infants who had experienced both birth complications and disrupted bonding were most likely to engage in violence when they grew up. In another study, 15 of the 16 most violent criminals were found to have had an extraordinarily difficult birth, and the 16th had an epileptic mother. Another research report found that certain types of birth complications were associated with a preferred method of suicide, which is violence to the self. For example, suicides involving asphyxiation were closely associated with breathing difficulties at birth. Suicides by violent mechanical means were associated with mechanical birth trauma, for example, forceps delivery. And drug-related suicides were associated with drugs having been administered to mothers during labor. Furthermore, the American cesarean birth rate was 4.5% in 1965. It is now about 1 out of 3 hospital births, and the highest in the Western world. In addition to being a major intervention in the natural birth process, cesareans involve more separation between mother and infant at birth, increased chances of the infant being assigned to a neonatal intensive care unit, and increased risk of disrupted bonding. Painful experiences, unmet needs, trauma, drugs, shock, and separation of the mother and infant make a difference. These cultural birth practices generally ignore the child's needs, what is natural, and what supports bonding. In 1975, obstetrician Frederick Laboyer published a book called Birth Without Violence. In the United States, birth is often still violent, and so are we.
So there is a direct link between how we come into this world and where we end up. And this epidemic of violence is something that me and my colleagues have been speaking about. Like, I mean, just like, it's crazy. It's like people are just going crazy. So it makes sense. It's this accumulation of trauma, and then it's passed down and perpetuated through each generation.
Mm-hmm. Yeah. I'm going to get to that a little bit more later.
Okay.
So here's another cultural practice. Mm-hmm. And for this, I ask viewers and listeners to please close your eyes for a visualization related to this additional cultural practice. So with your eyes closed, imagine that you are resting comfortably, perhaps with a dearly loved person you enjoy being physically close to. When a few strange people enter the room and proceed to pick you up and carry you away. You protest and struggle, but they are stronger than you are. They take you to another room where they remove your clothes, strap you down on your back on a table. The only part of your body that you can move is your head. All this time, they continue to disregard your protest. Then a man enters, and after seeing that you are securely restrained, he uses a clamp, knife, and other instruments to cut off a piece of highly sensitive specialized tissue from your genitals. The procedure lasts about 15 minutes. You scream repeatedly, but your screams are ignored. Notice how you feel. Then open your eyes and remind yourself that you are safe. This visualization is similar to what happens to a male infant when he is circumcised. From the experience of the infant, it is an act of violence. Circumcision causes extreme pain and trauma, potential withdrawal and shock, behavioral and neurological changes, loss of an important functioning body part, reduced sexual pleasure, potential psychological problems, more than 100 possible complications and risks, and many unknown negative effects. There are no proven actual medical benefits of circumcision, and no national medical organization in the world recommends circumcision. Aside from Americans, Muslims, and Jews, only about 5% of the world's males are circumcised. Some doctors and nurses refuse to participate in this practice, and some Jews don't do it. The more men know about circumcision, the more likely they are to regret it and oppose it. Some men are angry about being circumcised. Other men are angry and do not know it, or do not connect their anger with circumcision. Child psychiatrist Lenore Terr said, quote, "A whole life can be shaped by an old trauma, remembered or not," unquote. The extreme pain and trauma of circumcision violate the child's need for protection from harm, involve separation from the mother, maltreatment, and disrupt the mother-infant bond. Maternal-infant interaction and infant behavior are adversely affected after circumcision. Long-term effects may increase the likelihood of emotional and behavioral problems, including antisocial behavior. As a final note on this topic, I initiated a legal challenge to Medicaid circumcisions. I invite you to go to GoFundMe.com, search my name in quotes, and you'll be able to find a description and status of that legal case.